Every year, thousands of patients undergo surgery to fix nose problems. Most of the time, everything goes great, but sometimes patients develop something called empty nose syndrome.
It's a very rare disorder, and for patients who suffer from ENS, the symptoms are crippling. So crippling, some patients end up committing suicide. The problem, doctors can't figure out what's going on. CBS 19's Tomas Harmon is live in the Newsplex with more. Tomas?
Tara and Dan, in 2003, Erica Snyder had everything going for her, a loving family, a husband, just a few semesters away from finishing grad school. Then she went under the knife to fix what her doctor called a deviated septum. Now, 13 years later, she has lost everything, all because Snyder developed empty nose syndrome. It's a disorder that causes patients to feel like they are suffocating.
I felt like I was over-breathing, just that there was too much air going in. But at the same time, it felt like drowning. It's really hard to describe.
Erica Snyder lives with empty nose syndrome.
Pretty much 24/7, you think you're suffocating, and you try to distract yourself from that the best that you can. You try to treat it with all of this stuff.
She has an arsenal of home remedies to fight the feeling that she can't breathe.
I wear breathe right strips to keep my airflow smoother.
She's managed to regain some feeling, but she has friends who didn't. And when that happens,
I have had friends who killed themselves from this.
Unfortunately, the medical community can't agree if ENS exists.
The true diagnosis is difficult because there isn't even truly a consensus on what the disease actually is.
All right, I'm just going to take a look in your nose.
Dr. Spencer Payne is one of a handful of doctors working on ENS patients. He says people like Snyder exist in a medical paradox. They say they can't breathe, but everything looks healthy, so most doctors think this disease is all in their head.
The doctor would say, oh, it's because you're single. You're just like, you know, like you're just stressed out that you're not married yet.
Dr. Payne disagrees. He thinks there is a very real cause to this disorder.
The common thread for people who've had surgeries, they've had really aggressive surgery. They've had a lot of things removed from the inside of their nose.
Surgery that Dr. Payne thinks can create nerve damage inside the nose that interferes with breathing.
This is a nose of a person who has no turbine.
Which is why Payne believes Snyder and other patients like her are truly suffering.
ENS absolutely exists. It's just not necessarily certain what that means for every specific patient.
And while the disorder has changed her life, Snyder says she is looking to the future.
It's just like bad luck. It happened to me, and I just want to help find a way to like prevent it for other people and like help come up with a cure.
Dr. Payne says that ENS is incredibly rare. Maybe 1 in 1,000 nose surgery patients will get it, and both Dr. Payne and Snyder agree. If you're worried about this, the best thing to do is to talk to your doctor. If you want to learn more about ENS, we have links posted online at newsplex.com. Reporting live in the Satellite Center, Tomas Harmon, CBS 19 News.